Ejaculation is a process that occurs in males and females, but it is different for each gender due to their distinct reproductive anatomy. Let's discuss ejaculation process in both males and females. Male ejaculation. Arousal. The male ejaculation process typically begins with sexual arousal. Sexual stimulation, whether through physical touch, visual stimuli, or mental arousal, triggers a response in the brain that initiates the sexual response cycle. Erection. As a result of sexual arousal, the blood vessels in the penis dilate, allowing increased blood flow into the erectile tissue. This influx of blood causes the penis to become erect and firm, ready for sexual activity. Stimulation. During sexual activity, stimulation of the penis, particularly the glans, head, shaft, and other sensitive areas, continues to build sexual tension and excitement. Sensory nerves. Sensory nerves in the genital area transmit signals to the spinal cord and then to the brain, indicating increasing sexual arousal. Ejaculatory reflex. As sexual arousal intensifies, sensory signals from the genitals reach a threshold that triggers the ejaculatory reflex. This reflex sends a signal from the spinal cord back to the genital area, specifically to the muscles at the base of the penis, called the bulbospongiosus and istiocavernosus muscles. Semen emission. The ejaculatory reflex causes the muscles at the base of the penis to contract rhythmically. This contraction pushes semen from the seminal vesicles and the prostate gland into the urethra, creating a mixture of sperm and seminal fluid. This process is known as semen emission. Ejaculation. Once the semen is in the urethra, the rhythmic contractions continue and force the semen out of the body through the urethra. This is the moment of ejaculation, characterized by intense pleasure and the release of semen from the tip of the penis. Orgasm. Ejaculation is often accompanied by orgasm, a powerful and pleasurable sensation that is often considered the climax of sexual pleasure. Resolution phase. After ejaculation, the male body typically goes through a refractory period during which it is temporarily less responsive to further sexual stimulation. The refractory period can vary in duration from person to person and can be influenced by factors such as age and overall health. Female ejaculation. Female ejaculation refers to the release of fluids from the female reproductive tract during sexual arousal and orgasm. It is different from male ejaculation in several ways. Vaginal lubrication. In females, sexual arousal leads to vaginal lubrication, which is the production of clear, slippery fluid by the vaginal walls. This lubrication helps reduce friction during sexual intercourse and enhances comfort and pleasure. Female ejaculate. Some females may also experience female ejaculation, which involves the release of a small amount of fluid from the female prostate, Skene's glands, or other structures around the urethra during intense sexual arousal or orgasm. This fluid may vary in consistency and can sometimes be mistaken for urine, but it is not urine. Orgasm. Female ejaculation may or may not be associated with orgasm, as not all women experience it. For those who do, it can enhance the intensity of the orgasm. It's important to note that female ejaculation is less common and less well understood than male ejaculation. It is a normal variation of female sexual response, and its occurrence can vary among individuals. Communication and understanding between sexual partners are essential to ensure that both partners have a satisfying and comfortable sexual experience.